So you're going to get your first few aligners today. You're going to wear them 20 to 22 hours a day. You'll take them out when you eat, take them out when you brush your teeth, when you're drinking anything other than water. No fitness water, no seltzer water, no flavoring in your water, and no lemon in the water, just nice clean water, okay? I'm going to show you how to put them in and take them out. So when you get your aligners, they're going to be in a little baggie. There should be one top and one bottom of each one of those. Typically on the biting surface of them, there should be letters and numbers on there to let you know which one's the upper, which one's the lower, and which number you are in that series, okay? When you take these out, to put them in place, you're going to start from the front, work your way to the back. You're always going to use your fingers. Don't bite these aligners into place. Okay, and there's your lower one. All right, now when you take your aligners out, you're going to start all the way in the back on one side or the other, pull down and then kind of pull towards your cheek and work your rest of the way around to get that aligner out of there. When your aligners are not in your mouth, make sure that they are in your case. If it's not in your face, it should be in your case. All right, now you're going to wear these, like I said, 20 to 22 hours a day, about 1 to 2 weeks, depending on what your orthodontist tells you to wear for each one of these aligners. To keep these clean, you're going to use antibacterial soap and a toothbrush. Don't soak in anything, especially mouthwash or denture cleaner. If you just use the antibacterial soap and the toothbrush, brush them inside and out every time you brush your teeth. This should keep them nice and sparkly clean for you.